Come in. Hi, Kinga. It's me, Saida. I'm back. I'm washing my hands. I'm closing the curtains to provide privacy. And I'm going to verify your ID. And if you can just tell me your name and date of birth.
It's Kinga Koshiba, June 3rd, 1989.
And you still would like me to call you Kinga?
Yes, please.
Okay. And just like I mentioned earlier, I'm going to do a focused assessment. So today we'll be focusing on your head, on your neck, on your cognitive function, on your comprehension, on your sensory and motor skills, and I want to check intactness of your cranial nerves, okay? So it will be neurological assessment, okay? And my hands are clean, so I'm gonna start with your head, okay? So do you know why are you here today?
Yes. I'm for my assessment.
That is correct, yes. And what did you have for breakfast this morning?
I had cereal.
Okay. And when is your anniversary?
Anniversary, it's January 28th.
Okay. Do you have any professional or school goal you want to share with me? You're currently working in the restaurant business,
I
right?
am working at the restaurant, so I would like to have some vacation soon.
Okay, that's a very good goal. I guess you have been working quite a bit then, okay?
Yes.
Okay, so my patient is alert and oriented, times 4. She has good short-term memory, she has good long-term memory, she was able to use, judgment and determine that she's been working a lot and it's time to go for vacation. So very reasonable, totally understandable, okay? So, well, your mind is fine, so let's just move on and check the rest of your body. So I'm gonna look at your head, and I don't see any lesions. I don't see any evidence of lice or unkept hair, or just generally you're very well kept, and your posture is very straight, and you're clean, you don't have any odor, and I don't see any lesions on your skin. I'm looking at your face as well, and you have nice skin, no pimples, lesions, evidence of any scar or any surgeries. I'm gonna look at your ears, okay, and both of the ears are symmetrical and uniform, and I'm glad you turned your head so I can see that your neck is like fully functional. Okay, wonderful. So I'm gonna look at your oral cavity now. That's what we call mouth. Go ahead and open your mouth for me. Okay, and you have nice white straight teeth. I don't see any evidence of caries or missing or loose teeth, any lesions. Nice pink moist membranes. Stick your tongue out for me and say ah. Okay, and I see both tonsils and uvulas are present. There is no inflammation on the back there. Okay, wonderful. Excellent. And I'm looking at Kinga's eyes. I noticed that she's wearing eyewear. When was your last eye exam?
It was in April.
Okay.
This year.
Very good, very good. And she has white, her eyes are nice equal pupils, and I see clean sclera with no like fogginess or anything, nice glossy white parts. Okay, I'm gonna just go ahead and check your lymph nodes now, okay? We're gonna start with the one in front of the ear, and it's called preauricular, posterior auricular, occipital, the upper cervical one, mandibular, mental, submental, lower cervical, and subclavicular. I didn't feel any, inflamed lymph nodes or any swelling. They were just like nice beads moving around non-tender Now I'm gonna check here, your thyroid, okay? And I don't feel any enlargement there. Go ahead and swallow for me. Swallow again. Okay, and I felt it moving up. That's a normal finding. Okay, so, well, very good, very good. So now I'm gonna just ask you a couple of questions. I'm gonna check your cranial nerves. You have 12 of them, okay? And each of them is responsible for different functions, okay? So I have something for you to smell. In fact, I used something on my hands earlier, and I need you to close your eyes for me and see if you can recognize, you smell close one of the nostrils and smell my hand. What is that essential smell?
Oh, I almost smell it. Lavender.
Yes, you're right. Okay, let's see. Go ahead and close your nostril. What is this smell?
It's like a citrus.
You're right.
Lemon.
Yep, it's exactly
Lemon.
it. Good, good. So you have intact olfactory nerve, okay? So now I'm gonna check your optic nerve. So what I need you to do, I have you stand for me, please. And we are about 20 feet away. So I have a chart here, it's called Snellen chart, and go ahead and read line 8 for me.
Oh, this one? O-L-G-K.
Okay? Close one of your eyes and read line 8 again, backwards.
K-G-L-O.
Okay, now close your other eye and read it from the beginning again.
O-L-G-K.
Okay, excellent. Looks like you have a very good ophthalmologist, and since you had a recent visit to the doctor, they accustomed your sight pretty well with the current eyewear you have, okay? So what I'll have you to do now is look at me, okay? I need you to close your eyes, open just one of them. Well, excuse me, we need some privacy here. Okay, close with your hand, open the other one, and look at me and
Bella.
tell me how many fingers do you see?
I see two. Two.
And keep looking at my eyes, don't look at the fingers.
Three.
Let's do the same with the other eye. Go ahead and close your left eye.
Two.
So you have intact optic nerve. Okay, now we're gonna check your oculomotor nerve, we're gonna check your trochlear, and we're gonna check your abducens nerves, okay? So what I'll have you to do is, I'm gonna have this object in front of us, and you're just gonna follow it, okay? I'm checking for gaze, just follow it, only with the eyes. I'm checking 6 directions. And she's able to follow it without shaking her eyes. Okay, excellent. So what I'll do now, I'm gonna provide some darkness in the room, and I need you to stare far in. Go ahead and stare far in, okay? And I'm gonna bring the light in each pupil. And right now it's dilated about 4-5 millimeters, and as I'm approaching light, I can see how her pupil constricted to about 3. Okay, I need you to go ahead and look at the far again, and I'm gonna bring the light. So right now her pupil is dilated to about 4.5-ish, 5 millimeters, and bringing the light in, and it constricted. Okay, excellent. So what I'll have you to do now is go ahead and stare far. I'm going to return the light back to the room. And what I'll have you to do is focus on the tip of this pen and follow it. Okay, and your pupils actually constricted. So at this point, I can say that her pupils are equal, rounded, they are reactive to light, and they can accommodate. Okay, now we're gonna go ahead and check your trigeminal nerve. Okay, so what I'll need you to do is clench your teeth for me, and I feel like bowl-shaped muscles here, and and I have temporal muscles engorged. Go ahead and open your jaw against resistance. Good. You have a good intact trigeminal nerve. Okay. Now we're gonna go ahead and do your facial nerve. So go ahead and smile for me, and frown, and pop out cheeks. Pop out your cheeks. Good, okay? And lift your eyebrows up. Okay, so you have intact facial nerve. Excellent. Okay. So let's check your acoustics. So what I'll have you to do is I'm gonna close one of your ears here and say, what did I say?
Bella.
Yes, I did say, oh, Bella. Okay, let's do your other ear over here. A, B, C, D, E. That is correct. That's what I said. Now I'm gonna go ahead and check the rest of your nerves. So it's glossopharyngeal. So what I'll have you to do is open your mouth for me. Open your mouth. Stick your tongue out. Say okay, and you have intact glossopharyngeal nerve. Okay, and you have. I'm gonna have to use tongue depressor here. Go ahead and we'll check if you have gag reflex. Okay, and your gag reflex is intact there, okay? So the patient is able to talk and able to swallow. We saw that earlier. I'm gonna check your accessory spinal nerves. Tuck your chin to your chest, back, shrug your shoulders against resistance. Okay, you have intact cranial nerve 11, and the last thing would be to check, stick your tongue out and wiggle it for me, from side to side. Okay, excellent. So you have intact cranial nerve 12. Very good, very good. So while I have you standing up, let's go ahead and check your gait and the balance, okay? So what I'll have you to do is go ahead and walk about 10 feet and then turn around and come back to me. Okay, and she's walking in a nice rhythmic motion. Her hands are swinging like they're supposed to. She has good balance. Excellent, you can come back to me. And now I'll have you close your eyes, hands, yep, you already know what to do, huh? I guess, and we're gonna check your balance here, okay? So, excellent. So there's almost no movement. So she has very good balance. You passed Romberg test, okay? Now what I need you to do is just bend your knees just a bit. Okay, very, very good. Excellent. Okay, so now we're gonna check sensory functions. Go ahead and have a seat on this table over here, okay? And what I need you to do is follow my finger to your nose, okay? Follow my finger with your finger to your nose.
To my nose?
Yep, like, you know, your finger to your nose.
Oh, gotcha.
Finger to your nose.
Sorry.
As fast as you can. Okay, excellent. You did a great job. Relax your legs here, and what I need you to do is tap your lap with your hands. Just go like that as fast as you can. Go ahead. Very, very good. Excellent. You can stop now. You did a very good job. Okay. All right. So let's just move on over here. So what I have, a couple of things for you. Just disclaimer. It's not gonna hurt you. Okay. So this is called light touch, and when I'm gonna touch you, you're gonna tell me, you know, that you feel it. Just say now when you recognize it. Okay. Close your eyes for me.
Okay, I just don't. Yeah.
Just say now
No,
when
Now.
you feel it.
no, 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 no. No, 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 no.
Very good, very intact light touch, girl. Okay, now have a sharp and dull object, so I'm gonna touch you and you're gonna tell me whether, what did you feel, okay? Light or a sharp or dull object, okay? So close your eyes again. The idea is to have your eyes closed for those tests, okay?
Now,
Sharp or dull?
dull, dull, sharp, dull, sharp, sharp, dull, dull, dull.
It's all sharp actually, maybe it's not
Oh.
sharp. It's not sharp enough. Like this one is a dull one. You know
Oh,
what I
yeah,
mean?
yeah. I just like really
Yeah. So, okay. It's a toothpick, I guess it's not sharp enough. Okay, but you can take a lot of pain, okay, and you're very pain tolerant. Okay, go ahead and close your eyes again. We're just gonna continue. So this would be dull, okay, just to compare, and this is sharp. So,
I gotcha.
all right, go ahead.
Dull, dull, sharp, 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 sharp.
Okay, very good. You're doing it very sharp now. Close your eyes.
Sharp, sharp, dull, dull.
Okay, excellent. And now we're gonna do 2-point discrimination. So when I'll be touching you, you have to tell me whether you feel it in 1 point or 2 points, okay? So go ahead, close your eyes again.
One. Two. Two. Two.
That is correct.
Two.
You did feel 2. Okay, and now we're gonna do a reflex test. So this one is actually, I just want to do a couple more things for you, okay? Go ahead and close your eyes for me, please. And see if you can recognize what is in your hand, okay? So, gonna put it in your left hand and tell me what do you feel? It's not the easy one to recognize.
Oh, it's like a screwdriver, like a, what is it called? Oh my god. You know, the key, the...
Yes, I know what you mean.
Oh, help me with the word.
Yes, it's like a wrench, right?
Wrench,
Yes.
there you
Okay,
go. Wrench.
excellent.
Sorry.
And then I'm gonna give you another object here and you're gonna tell me what you feel here. Okay?
So this is the flashlight.
It's a microphone, but
Oh.
close enough. So I'll just say you did a very good job. Okay, now I'm gonna write letter on your hand and you just have to tell me which one did I write.
Okay.
How did you know? You're right. And let's do another one. Excuse me,
Oh,
Bella.
now I feel like different eyes.
Can you assist another patient, Bella?
B.
That is correct. How did you know I'm gonna do B? You did a very good job. And the last part is our reflexes, okay? So what I'll have you to do is relax your hand. So we're gonna check some reflexes and I'll let you know how you did it, okay? So we're gonna start with this brachial one. Relax your hand, and I have a hammer. and I saw her finger, her big thumb pop out, and the muscle contracted here, okay? So, erected on his side, kind of like,
Oh, like this?
yeah, right here is the tendon, so I'm gonna hold it right here, okay? Okay, and I felt it contracted over here. Okay, now I'm gonna do the triceps over here, so I'll have you relax your arm. Right here. Okay, and you saw that swing, so this one swung and this one contracted. Let's do the same thing on the left. Excuse me, Bella. I guess we're losing our tongue depressor. Okay, and you saw this finger pop out and the muscle contracted. Erected your arm. Okay, I feel the tendon, so I'm gonna rest your hand on my tendon over here. And you saw the muscle contracted here, and you saw the jerkiness of the of the arm. So we're gonna do the same thing now with the left arm, and that's where you feel it, right here.
Чего она жует?
Okay, and it spun out, and this one contracted. So you have the tendon reflexes there, 2+, which is a normal finding, okay? So now we're gonna do Achilles ones. So relax your, did you wash your feet today? I guess you're well kept, so you did. Okay, and I saw it popped out. I'm gonna do the same thing on the right. And I saw it popped out. Okay, well, very good. And it looks like, your all systems we were just checking, they're intact. You did a great job, and thank you for being my patient again, okay? I'm gonna wash my hands, say thank you, gonna open the curtains for privacy, and thank you again.
Thank you.